doctor's ready to see you now for your 5-minute checkup. Tune in every Thursday at 10:30 a.m. for the Z's 5-minute checkup to get your real health questions answered by real health professionals in a real down-to-earth way. Send us your questions via voice note to our WhatsApp line 876-574-5591. The 5-minute checkup on Zip 103 FM.
Hello, good morning. Hi. Welcome to your 5-minute checkup, where you'll have your real health questions answered by real health professionals in a real down-to-earth way. You don't know what your boy Zess. Now, why am I speaking to you like I'm a call center agent?
Me nearly answer to you. Hello.
You see, sometimes you have a switch it up. You understand me? You can't just come in with the nice all the time. You understand me? Yes, man. My side, good morning. You know it's your boy Zest. You know the vibe, you know the voice, you know what's going, right? Now, asthma is one of those conditions that can turn a simple breath into a struggle. Now, listen, when I hear about people with asthma, you know, I don't understand how them do it, but I'll use the excuse that whenever I'm around them, I take their breath away. Anyways, here in Jamaica, dusty days or even the cold blast from an AC can be enough to set off a flare-up. But what's really happening inside our bodies during an asthma attack? And how can we control the triggers to keep our breathing easy? Now, today, we're diving into Asthma 101, triggers, treatments, and tips. And I was told by Little Birdie that our doc for today is fresh, new, first time. She debut in a place. Ladies and newbie. Good morning, Dr. Jody Pownell, general practitioner and aesthetic physician. How you doing?
Hi, good morning. I'm doing quite well. You sound amazing.
Hey, stop it. You see, no other doctor come on here and tell me I sound amazing. You understand me? So I just hope you know now that you're the new and you're also top of the list, right?
Okay,
all right, lovely. I hope none of them listening right now, because I know they can bring it up next week Thursday. Watch, man. All right, my side. Remember the disclaimer: the information provided should not be taken as medical advice. If you're having a medical issue or a medical concern, please consult your doctor. And remember, guys, all your questions are being received on our WhatsApp line. So if you have any questions for Dr. Pownell, you can just run it on the WhatsApp line 574-5591. Doc, you ready?
Yeah, man.
Let's go into it. So, for those who may not know, what exactly is asthma and how does it affect the lungs? Talk to me.
Okay, so we typically describe asthma as a chronic inflammatory condition. So it affects the airways of the lungs. So there is obstruction to the airflow, and it is reversible. So the tubes that are carrying air in and out of the lungs, essentially they become very overly sensitive, what we call hyperreactive, and they narrow very easily, what we term bronchospasm, and especially in response to certain triggers. So there's a lovely acronym. I love to use acronyms to help people to understand, make it a lot easier, because asthma can be so complex, called BREATHE. BREATHE. So the B, bronchial narrowing, the R, reactive airway, and the E, excess mucus production that is happening. So it makes it so difficult. You can imagine like you're trying to squeeze a straw and you're trying to pull some liquid through it, and the lumen is narrowed, you're having it being blocked up. It makes it so much more challenging to breathe. Or to take the liquid up.
You know, when you put a straw in the cup and the airway, the section where the straw goes through kind of tight, and now you try to drink the juice and the juice barely come up. So asthma go on?
Perfect example. And then, I mean, that could, if you can really imagine that happening, we can then look at the symptoms that often come or what would happen to the body while you're having an attack.
No, I want to know that part now. Let's go into it. Yeah, man.
So imagine that's happening. You have the airflow limitation. So the passages are narrow. There's the excess mucus. The airflow is getting less and less. So you might have your shortness of breath, your wheezing. You can have episodes of cough that can happen. Sometimes you see it worse at night or early morning. These are very, very classic. You have the T, the tightness of the chest, because the tightening of the airway, it makes the muscles just kind of overwork essentially to try to push air through like a block pipe, and you have hyperresponsiveness, and you have the episodes of breathlessness. So all of this is happening, and it can be very, very frightening too.
Because you feel like you're dying. I mean, you whenever you feel like you're choking or somewhat drowning, or like you try to hold your breath underwater, and you feel like your head start to hurt you, everything
Right.
bad feel. Yeah, man. But
Essentially,
I don't know if I get eventually run into this question in the interview, but what exactly does an asthma pump do? Because I know persons, they're always walking an asthma pump, and whenever they feel like they're having an asthma attack or something, they just go, and then all of a sudden they're good. Like,
right. So that's a very good question. So the asthma pump, it's very, very important. The medications that they are able to introduce into the airway, they're very good at helping to control the inflammation. There's a lot of underlying inflammation that's happening that we cannot see that needs to be addressed. So it has like your inhaled corticosteroids as well as medication to help to make those muscles that are causing the tightening relax. So you're now able to open that lumen or that airway a lot better, so that the flow of air can be a lot smoother. So that is what the asthma pump does.
so the pump basically just relaxes the airway so it can actually just fresh flow, nice smooth flow of air.
Right, and and control the inflammation, because there are things that are happening on a cellular level. Because when you're having the triggers that produce certain inflammatory cells, we need to be able to take care of that too. So it's a dual thing happening.
I see. I like that. And I always wondered why all of a sudden one little and all of a sudden them just good. You know what I mean?
Like magic,
Like magic, exactly. Now, how can I tell the difference between asthma and when somebody out of breath? Because sometimes I see the same symptoms, and I don't know which one. How I go?
Right. That's a very good question, because I'm sure we've all experienced being short of breath at some point.
Yeah, man.
But there is normal, and there can be it being due to asthma. So context matters, So it's not like a one size fits all. So shortness of breath due to asthma, it can happen with even little exertion. You could be just sitting down at rest, and it can just happen. With normal breathlessness, you find that it can be gradual in terms of its onset, and significant exertion typically tends to bring it on. So like if you're running, you're winding up yourself, you're climbing your stairs, all of that. But it's really in proportion to the level of activity. So with the normal situation, you tend to find when you relax after a bit, you tend to find some ease. But with the asthma, you may find that sometimes that shortness of breath can just be easily triggered again. You can have common triggers that set it off, like your dust, infection. And one important thing to note too, usually you find that the asthma breathlessness is often relieved with reliever inhaler. Right. So that is something you can note. And sometimes the diagnosis of asthma is not so clear cut. That's why as physicians we may do special confirmatory tests too. So you have tests that look at your lung function, that help us to know what's going on a deeper level, which gives us a better clue as a diagnostic test too.
Okay, all right. Zip to Chris, I see your questions on the WhatsApp line. I will address them soon, but I need to get into this with the doc. So, can secondhand smoke make asthma worse, or like even if you don't even smoke yourself, you just around somebody like in them car and you realize that you smell the secondhand smoke? Is that a case where it can make it worse?
Yes, most definitely. Even if you've never touched a cigarette, breathing in secondhand smoke, it can cause, we'll go back to this whole inflammation of the airway and narrowing, because with the smoke, it introduces a lot of irritants to the airway. So you can have like fine particles, irritant gases, and even some toxic chemicals can be introduced. So the answer is yes.
Since you start listing on some things, give me some triggers that can trigger asthma, and how exactly can we reduce them?
All right. So you can have a lot of triggers. Again, lovely acronym. Trigger, TRIGGER. I'd love to share with you. So T, temperature extreme. So even cold, very hot air can irritate the airways. R, respiratory infections. How many times you ever see persons who get sick and their asthma get triggered off? That's a definite trigger.
Right.
Sinus infections, right? You have the eye for irritants, you smoke, your heavy perfumes, grass like pollen, dust mites, exertion, which we mentioned about.
So wait, hold on there. You tell me some cologne a kick. And my cologne where a kick can trigger somebody asthma?
Yes, that is absolutely true. So we have to be mindful of it.
God forbid a man just want to smell good. Jesus.
I know, right?
My goodness.
I know, but it's something to be mindful of because not everyone will get triggered, but you have to just know what you tend to find happen to you. And even things like emotional stress, and even acid reflux too.
That is crazy. Somebody on the WhatsApp line just asks, acid reflux, does it trigger asthma?
That triggers asthma. By the way, as I know you mentioned it, it's very important that you go to your doctor and discuss the symptoms that you're having because sometimes you can have several things happen in one picture and we need to take you through proper history examination to determine is this asthma versus a secondary condition.
Right.
But yeah, and in terms of just controlling, if you think about it, if you're being surrounded by triggers as much as you can, you can limit exposure. You could wear your mask if it's very dusty, windy environment. You can try not to wear such strong scents if that's a trigger.
Hey, listen to me now, man. You see when the shipment come in and the Dubai cologne them start kicking up.
My.
Doc, I have to smell good in the doc. So if you know say you have asthma, stay away from me, you know. You understand me? Yeah.
Oh my goodness. But yeah, those are just a few. Cleaning your fans, your AC, limiting dust, and limit the things that cause inflammation. This is a very important point. We don't really dive deep in that, but things that cause a lot of inflammation tends to trigger excessive mucus production. So we're talking about, even for some persons, dairy, excess sugar, ultra-processed food can be a trigger.
What about air fresheners? How'd that go? Is that like way? Can that like affect asthma or trigger it in a way?
It can for some persons because we then get to strong scents and some of them may have those fine particles that just somehow cause irritation because the airway is just extra irritable.
Okay. Now, for example, let's say somebody's about to go through, a little asthma attack, right? How should they be using their inhalers during an asthma attack?
All right. So during an asthma attack, because that's a good question too, because using the inhaler the right way is just as is crucial, right? So you want to shake your inhaler before to help mix the medication. You want to remove the mouthpiece, make sure it's not clogged up, and you breathe out fully. So this empties your lungs so that there's room for the medicine. You then place the mouthpiece in your mouth and close your lips around it. So it creates a tight seal, but you're not going to bite down.
Right.
And then you press down on the inhaler to release a puff at the same time as you take a slow, deep breath. So this is the most common mistake. People sometimes spray and then they breathe in too late or too fast. But you need to breathe in slowly and deeply as you press. And then you hold your breath for a few seconds. The purpose of that is really to help the medication to settle deep in your lungs, and then you breathe out gently. And you can just wait about 30 seconds thereabouts if you have another puff to administer.
And you just feel like you stopped dead, clearly. Nah, man, because honestly, sometimes I see some person go through an asthma attack and I'm just like, is this you being closer to God at this point? Because I don't know what's going on. You're doing a lot right now. Because I personally don't have asthma, so I can't imagine what they're feeling. I know what it feels like to be under the water, can't breathe, or I know what it feels like when like the desert, dust and something they come in and Kingston and blah
like
blah. The Saharan dust. Yeah, so I know what it feels like when I can barely breathe and I feel like a bunch of dirt or dust in my nose.
Yeah.
But for somebody with asthma who really feel like their lungs no longer exist and they're breathing through nothing, I feel like they know that they feel like they're closer to heaven than anybody else. So it makes sense to use your ear inhalers properly, guys. Please.
Yes.
Right.
Yes.
I have a question on the WhatsApp line for you, right? We have Ziplica here, Nizar. Nizar is asking, what's the difference between asthma and bronchitis?
Okay. So the important thing with asthma, you have a chronic inflammation that's happening that it essentially can cause remodeling, right? It's definitely affecting the airway. It can be permanent, and you can have triggers that can happen. So even in the absence of infection, it is still going on. You have the underlying active airway inflammation. Whereas typically with the bronchitis, you're having the inflammation of the airway, and sometimes it's typically begin as a result of an infection. So typically we can just address it, whether it is antibiotics, and it can go away, or it can be significantly improved. But the asthma, there's no cure for the asthma.
Now you see, now you're getting into one of my actual final question, but I want to ask you one before that one, right? So just stick a little pin right there. So yeah, now them picnic they will love ramp up and down outside, right? Can children with asthma play sports and all them things safely?
Oh yes, yeah, man. Children with asthma, they can play sports safely, but it is very important that we are able to advise them on what to do before playing, for example, to be safe, right? So oftentimes we need pre-exercise. If they normally have exercise-induced asthma, they can take the reliever inhaler maybe about 15 minutes before exercise and just gradually warm up. And that's very, very important. And then during the sporting activity, they watch out for early warning signs. So like if they're coughing, wheezing, having chest tightness.
Right.
So if the symptoms are appearing, you want to just pause, use your inhaler, and then you rest, stay hydrated, and then even after exercise. So you don't just stop. So you want to know if you're having any delayed symptoms. Sometimes it may not be the minute after you stop, but even 5 to 20 minutes or so, or even more, you can have delayed symptoms. So you want to watch out for that and manage accordingly.
I like that. Now we're going to take up the pin from earlier now. Yeah? Before we wrap up, if someone hasn't had like a whole asthma attack in years, I'm talking back in the day when I was going to high school, I had my asthma attacks, but right now I'm good. Do they still need to carry an inhaler wherever they go?
Wow, so that's another good question.
I have good questions all day, girl. All day.
So, I mean, the response can be two-sided, but this is the reality of it. The answer is yes. So even if you haven't had an attack in years, you should carry or have one available at least. Because if you've ever been diagnosed with asthma, not carrying an inhaler is like not keeping a spare tire. So, like you might need
Whoa.
But, you may not need it for years, but when you do it, you're very glad it's there. And just quickly, asthma can be unpredictable. You can have the airway inflammation we spoke about that may persist silently. So even when you're not having symptoms that underline the whole cascade with the inflammation and the airway being hyper-responsive, that can remain. And I must tell you as well, because I love when persons are very knowledgeable and they can look up information. We are very much guided by certain guidelines, like the GINA guidelines, we call it. And it does advise that we have patients still have their inhalers, and also lifestyle changes or exposure. So new environments can bring back triggers and stuff. So we need to be very mindful of that essentially.
I like this. I like this. I feel like
there's a lot going on, It's not a clear-cut picture sometimes.
Right.
But that's why the communication with your physician is crucial.
Now, speaking of communication with my physician, you're my physician right now. I want to communicate with you. Where can we find you?
Lovely. All right. We're currently relocated to 94B Old Hope Road, shop number 7. So we have our special opening at the end of the month where we'll have our discounts and our doctor's visits, and we're launching some new aesthetic services like body sculpting, massage, weight management. And for those of you, we encourage you to follow us on Instagram for updates and other health guides. We can follow us at Fit Life Medical _Center and contact us. I'd love to hear from you. You can even have online consultations if you need. So 876-542-4545.
Nice. I like that. Dr. Jody Pownell, you did a great job for your first time here on the show. I love it. Johnny over here love it as well too.
Oh, that's lovely.
Yes,
guys, my reminder is for you to keep fit. That's what Fit Life is about. FIT. Firm
like
in transforming your health. We're here to help you to be your best you, both inside and out.
You want these acronyms, man? No,
yes,
sir.
I love it.
Listen, let's start calling it acronym boss. You understand me? Know yourself, man. Thank you so much for coming through to the Z, and we're definitely going to be having you again very, very soon. All right?
Thank you so much. Have a blessed day. Take care.
You too. Zip the crats. That's your boy. That was your boy Zest. Nah, I'm your boy Zest. That was your 5-minute checkup. You done. It's your boy Zest. Tune in next time to have your health questions answered by real health professionals in a real down-to-earth way. Johnny, your time.
Tune in every Thursday at 10:30 a.m. for the Z's 5-minute checkup to get your real health questions answered by real health professionals in a real down-to-earth way. The 5-minute checkup on SIP 103 FM.